Now, original Medicare includes Part A. Again, this would be something I'd want to write down as well. Part A pays for your hospital bills. Part B covers your doctor's bill. Now, once you've enrolled into Part A and Part B, you're going to have two paths to go down. One is a supplement policy, a Medicare supplement policy, and the other is an Advantage plan. Both of these policies are used to pay for the 20% that Part B does not cover. Now, Part A, again, that pays for your hospital. There are no premiums for people that have paid Medicare taxes for at least 10 years. So Part A, there is no cost when you turn 65 if you've paid taxes for at least 10 years. For people that turn 65 that have paid less than 10 years taxes, there will be a premium for that. So if you have less than 10 years where you've paid less than 10 years in taxes, there is a premium for Part A. Part A, usually it's an automatic enrollment. So when you turn 65, you should automatically be enrolled into Part A. If not, then you'll go to your local Social Security office. So what does Part A cover? It covers semi-private rooms, meals, general nursing, hospital services, supplies. It does not. It does not cover the first 3 pints of blood. I guess, you stock that blood up, keep it in your refrigerator, and if you have to go to the hospital, you can pull some blood out and take it with you. Inpatient mental health care coverage, there is a limit to that. It's 190 days per lifetime. You do have coverage up to 90 days and then an additional 60 days of lifetime reserve. But understand this, once the 60 days is used for the lifetime reserve, that's it. You still have your 90 days, but once you use the 60 days of your lifetime reserve, that's it. Medicare does not include or it excludes private duty, nursing, comfort, convenience items, things like that. Toothbrush. Now, what happens when you go to the hospital? There are some gaps in Medicare. So I would write this down as well. Day one, when you go into the hospital and you're admitted to the hospital, you immediately have to pay $1,408. That's for the first 60 days. The next 30 days, you start paying $352 a day. And then days 91 through 150, you pay $704 a day. Skilled nursing facility care coinsurance, that's a fancy way of saying long-term care or nursing care. There is some misconception that Medicare will cover long-term care. That is false. It does cover a very small part of it, but in general, it doesn't pay for long-term care. Now, the first 20 days, Medicare does cover the cost. From days 21 through 100, you pay $176 a day. And after that first 100 days, after that, your long-term care needs are all on you. Now, we could do a whole different workshop on long-term care. Just remember that Medicare pays very little towards long-term care.